Good afternoon, Dr. Berger.
Good afternoon, Irina.
So, there are a lot of complaints from patients who constantly say, I cannot manage my appetite, especially premenopausal, menopausal women, and they're really beating themselves up, saying that lack of discipline and they cannot do it. What are your thoughts about obesity overall?
Okay, so our thinking with regard to obesity has changed over time. There was a period where it was thought that weight control was all about willpower, and that if you didn't have enough willpower, that was the reason that you had obesity. We've understood now for over 10 years that obesity is a chronic metabolic disease and that it's driven by derangements in a number of hormones that are related to appetite and satiety. So I'll just briefly go into those. So it's not clear for any individual patient how much fat tissue is going to start to cause leptin resistance. But leptin is a hormone that's secreted by the fat cell, and the more fat cells and or the larger the fat cells, the more leptin in the bloodstream. Now, leptin is supposed to tell the hypothalamus that we have enough calories stored in the form of fat and we can curb appetite and therefore maintain a steady body weight that way. However, it is possible, particularly with the kind of foods that are so widely available in the United States that are highly processed, highly palatable, delicious and designed for you to keep on eating way past when you're full, that you can essentially outstrip the ability of the hypothalamus to regulate your appetite. And what happens is it's kind of like having a noisy air conditioner in the background. Eventually you kind of tune it out and you don't hear it anymore. And the hypothalamus does the same thing with the leptin signal. Once it gets really high, it starts to ignore it. And therefore one of the brakes on your appetite, it doesn't work anymore. Also, paradoxically, two hormones, which you probably hear about a lot if you're listening to what's happening in the weight management space. So GLP-1 and GIP, these are the hormones that medications like Ozempic, Wegovy, Zepbound, and Mounjaro interact with and stimulate. The natural hormones, GLP-1 and GIP, aren't made in sufficient quantity once people get to a certain weight and or become pre-diabetic. So you actually have three brakes on one's appetite, things that are supposed to increase your satiety, make you feel full, that aren't working anymore when you get to a certain weight. And so it really doesn't become about willpower anymore at that point. And there's a counteracting hormone, the hunger hormone, ghrelin, that's always secreted whenever you lose weight. So this is the setup for the yo-yo kind of dieting that people often go through. The hunger hormone always goes up. That's an evolutionary thing. If we forgot to eat, we'd become hypoglycemic and pass out and bad things to happen. So it's really hard for anybody to resist that kind of hunger signal that's constantly telling your brain to eat. It's kind of like putting your hand on a hot stove and trying just by willpower to keep it on the burner. You can't do it. So that's why people tend to yo-yo. You lose weight a little bit, the ghrelin goes up, the other hormones aren't working, you regain the weight and then some. So that's why we, in the medical space, have changed our thinking about the causes of obesity and how to address it. It's not a matter of willpower. Unfortunately, in the public, it's not always understood. So that creates that bias against people with obesity. People think that it's their fault, that they don't have sufficient willpower. They just need to eat less and move more and so forth. And it really isn't about that at a certain point. And hopefully that through videos like this and a lot of the other publishing that's going on from societies like the Obesity Medicine Association and the Obesity Action Coalition, people are going to start to understand that it's a chronic disease and at a certain point not about willpower. So I think that's very important for patients to understand, for them not to beat themselves up, as you said, and to seek out treatment, because we can help with tools in our toolbox that are beyond the lifestyle changes that of course we want all our patients to make. So if you'd like to learn more about weight management in our practice, you can reach out to us in the office, 516-604-3418. Reach us online through the website, northeastmedicalpractice.com. And bear in mind that everything that we talk about in these videos is for educational purposes only. No doctor-patient relationship has been formed. And if you have questions, concerns about your health, you shouldn't hesitate to reach out to your healthcare professionals. But in the meantime, until we see each other again, be in good health.